Mesothelioma and Asbestos. Mesothelioma is a cancer of the mesothelial cells, which cover most internal organs. The two places in which mesothelioma can develop are the lungs and the abdomen, but it is most commonly found in the lungs. Mesothelioma, which affects the lungs, is called pleural mesothelioma, and in 70 to 80% of cases is caused by asbestos fibers being breathed in and becoming stuck in the tissue which covers the lungs. Pleural. It is not known for certain what causes mesothelioma in the other 20 to 30%, although research is continuing. Who suffers from mesothelioma? 2,000 cases of mesothelioma are diagnosed each year in the UK, and the number of people who die from it is expected to rise to a peak between 2011 and 2015. This is because the disease can take 15 to 40 years to develop, and blue and brown asbestos, thought to be the most likely types to cause mesothelioma, were banned only in the late 1980s. 85% of the people who suffered from mesothelioma are male, and this is thought to be because it is mostly men who work in trades involving asbestos. Most of the women who develop mesothelioma are thought to have breathed in asbestos fibers whilst cleaning the clothing of husbands who worked with the material. Tradesfolk who are particularly likely to have handled asbestos and are at high risk of developing the industrial illness mesothelioma include metal plate workers, plumbers, gas fitters, carpenters, electricians, builders, decorators. What are the symptoms of mesothelioma? Symptoms of pleural mesothelioma include pain in the lower back or side of chest, shortness of breath, persistent cough, weight loss, difficulty swallowing. These symptoms do not necessarily mean the person has mesothelioma, as they could apply to a range of other illnesses, but it is much more likely if they have had contact with asbestos. What is the prognosis for mesothelioma? The majority of people who suffer from mesothelioma only see their doctor when it has reached an advanced stage, and at this point the likelihood is that survival will be less than a year. This very much depends on a range of factors, however, which include blood count, general health, and the type of mesothelioma from which a person is suffering. One study found that 3 years after diagnosis, 1 in 10 people had survived, and after 5 years, survival rate was 1 in 20. However, other studies found a much better survival rate, with one study finding that 1 in 3 mesothelioma patients survived for 5 or more years, although this study only looked at people with epithelioid-type tumors. There is currently no cure for mesothelioma, but a range of drugs and treatments such as chemotherapy can help to delay the symptoms of the disease. What should someone do if they are diagnosed with mesothelioma? If there is a history of contact with asbestos in the workplace, an industrial illness claim may well be an option to consider. If successful, it will provide financial support to help the mesothelioma patient and their family pay for treatment and care, as well as substantial compensation for the exposure to asbestos that caused the illness. Although most compensation claims have to be started within 3 years of the injury occurring, the nature of asbestos-related disease means that the disease does not become obvious for many years, so industrial illness claims are still valid as long as they are begun within 3 years of diagnosis. About the author, Francisco Rodriguez. Do you need a mesothelioma lawyer? http://www.mesotheliomattorneyfreeconsultation.com